Hello, my name is Dr. Rory Murphy. I'm a neurosurgeon, and a common question I'm asked is, what is better? A cervical discectomy and fusion, or a cervical discectomy and disc replacement? And honestly, they are both similar. There has been shown no scientific evidence that one is better than the other. They both have their positives and negatives. And it really comes down to the challenge that you're facing. What exactly it is that you're having, including cervical radiculopathy or cervical myelopathy, and your overall health status. Generally, a cervical arthroplasty is very useful for younger people with good bone quality and a large soft disc herniation compressing a nerve causing radiculopathy. Fusions are more commonly utilized, especially in cases where somebody has a neck fracture, tumor, or potentially a bad infection. For people who could do a cervical disc replacement or just fusion, it's a very difficult decision. Studies from Norway, from the NORCAT study, and from Sweden have shown no long-term difference between a cervical arthroplasty and fusion. Cervical fusion is a very tried and trusted procedure that's been around for over 30 years. It's predictable. The negatives are that it can put more pressure on the disc above or below. And most people will need another surgery if they become symptomatic on the disc above or below, and the timing can vary. I always warn my patients that generally people may start developing more symptoms above or below because the disc above or below breaking down, somewhere in the 5 to 15 year range. Now, the potential advantage of a cervical disc replacement or an arthroplasty is by maintaining movement, there is less pressure put on the disc above or below, and that it might reduce the chance of those discs breaking down, or at least push the natural degeneration of those discs down further into the future. But this is not a guarantee. Sometimes discs just break down, even with a disc replacement, and a person will need surgery above or below the cervical disc replacement in time. Unfortunately, no surgical solution is perfect. And while both are very good, there are problems that can happen with a anterior cervical discectomy and fusion and with an anterior cervical arthroplasty. It's important that you as a patient know the potential risks and complications so you can choose the procedure that's right for you. And you know the potential challenges that you could face in the future, so you are able to address them, and you can choose which ones that you are willing to accept and potentially deal with in the future. For now, the general surgery approach is the exact same, going in the front of the neck. And the general mild and severe complications of damage to structures of the neck are the same for both. But specifically, for an anterior cervical discectomy and fusion, there is a risk that the bones won't fuse together, or that going through the bone graft or the titanium spacer, the bones won't stick together. And this can lead to neck pain or persistent movement and pressure on the nerves. Thankfully, this is rare. It can happen, symptomatic non-union or non-fusion can happen in approximately 1 in 10 or 1 in 20, depending on the literature and your risk factors. Famous examples of a non-union would be Peyton Manning, who had to have a revision surgery for his fusion. I'm sure he had a very competent surgeon doing his surgery, and he was young and healthy. For the anterior cervical discectomy and arthroplasty, specific risks for that include the implant loosening or failing or moving inappropriately. This can cause neck pain or damage to structures in the neck. Another potential risk with a disc replacement is a condition called heterotopic bone formation. Bone can get and grow into and around the implant, stopping it from moving correctly, leading to pain or buildup of bone going back onto the nerve. We use a number of techniques to reduce this risk, but it still may occur. Famous example of a disc replacement needing to have to be revised is Elon Musk, who had 2 disc replacements, and then he had to be revised to a fusion, and he talks about it extensively. Thank you.